Welcome back to The Headache Situation, a series of videos and podcasts brought on by the Michigan Headache and Neurology Clinic, free of any influence or sponsorship from any drug company, insurance company, or hospital corporation. As some of you may know, I'm Ed Messina, neurologist, headache specialist, and headache sufferer. This episode will be more informal than the previous ones. I'm not even wearing a tie. I decided that weekends are the best time to record. I don't want to delay these episodes any further. Because so many people have been requesting this topic, I'll talk about the main headache types and how they're commonly confused. This is a partial overview, by no means a complete discussion of all headache types. There are many of them. We can talk about more specific types later on other episodes. First, I got to give you the obligatory disclaimer. I'll read it. Remember to read the disclaimer at the beginning of this video and the one on the Headache Situation website. Basically, all of our videos are intended to be informational and educational and not intended to replace your doctor, physician's assistant, or nurse practitioner. Do not make any health decisions based on the information discussed here, but use it to talk to your doctor. Okay, now let's get back to business. There are primary and secondary headaches, and hundreds of headaches in our classification system. We'll talk about secondary headaches at another time. Today we'll talk about primary headaches, the most common ones. In other words, headaches which are not caused by something else, like head trauma or brain tumors or such. The most common headaches we'll talk about today are tension-type headache, migraine, and cluster. The most common type of headache in the world is tension-type headache, and then comes migraine and then cluster, among the ones we're going to be talking about. The most common misdiagnosis is sinus headache, whatever that is. I think once you hear about the other headache types, you might rethink what you may have been told or how you've self-diagnosed yourself. It's interesting, in the United States, we have a lot of commercials on TV about sinus headaches. Now, I was giving a lecture in Paris years ago. French is my second language. I used to live there. And I was talking about headaches, diagnosis of migraine, that kind of thing. And after the talk, a French headache specialist came up to me, and he was a specialist. He treated headaches in Paris. And he said to me, I was in New York last year at the headache meeting, and I noticed the TV commercials talk a lot about sinus headaches. What's a sinus headache? And I said, I don't know. It's something that I think was made up by Madison Avenue. Certainly there are sinus infections, and there's sinus drainage and sinus pressure. But that's different. It's not the kind of pain that our patients get with their clusters or their migraines or even tension-type headache. It's different, and it has to be distinguished. It has to be carefully analyzed when people tell you about their headache complaints. As a doctor, I must ask questions. Any doctor you go to, and I know I say this on every video just about, be sure they spend time with you. They need to talk to you. They need to ask you questions. You got to be able to express yourself. A lot of people think they have sinus headaches based on tearing or one-sided nasal stuffiness, but wait till you hear what I say about cluster. A lot of people think they have sinus headaches because the pain is in their forehead or around the eyes, so wait until you hear what I say about migraine. Now, sinus infections certainly are real, and drainage and pressure is common. Most of these infections are viral, even if there's discolored drainage. With what we are learning now about the beneficial intestinal bacteria in our bodies, it's wise not to jump into the antibiotics without really good reason. Also, I hear all the time about patients with misdiagnosed sinus headaches who end up on lots of antibiotics before we meet them. Most of these people have migraine or cluster. So you got to be careful who you talk to and what you tell them. The plot thickens, so let's move on and decide for yourself about what you know about headaches. If you're watching this, you're probably wondering about your own headaches. What I say today is based on the evidence-based headache classification system of the International Headache Society. The system is called the ICHD-3, the International Classification of Headache Disorders. Again, I'm not making your diagnosis. Your healthcare professional has to do that. But it might be awfully helpful if you understand what the experts are saying, and you can pass this on to your provider. I hate the word provider. Why did I say it? Your provider, your healthcare professional. A quick word about secondary headaches. Like I said, these are headaches that are caused by another disease process, and they can be dangerous. Not what I'm talking about today, which is tension-type, migraine, and cluster, but sometimes more severe headaches can imitate these more benign headaches. Tension-type headaches are common. Most people have experienced them, and they usually don't come to medical attention unless they go chronic. When everybody says, oh, I get headaches, I have a headache today, and you look at them and they look fine, the light is bright, they're eating a lunch or something, those are not migraine headaches, those are not clusters, they're probably tension type headaches. Everybody gets them. We all get them. Even those of us with migraine, we'll get tension type headaches, and we can tell the difference. Pay attention to your symptoms, you'll know what I mean. Tension type headaches can be mild to moderate intensity. They're never one-sided or throbbing and not aggravated by physical activity. These are the diagnostic criteria that we use when we make the diagnosis. I'm not making this up. This is our official criteria. Now, you can see where I'm going with this. They can last from a half an hour to a week at a time. Tension type headaches essentially don't have a personality. The other headaches have a personality, as you'll see. These tension headaches can be infrequent, less than once a month. They usually don't interfere with life or cause any lasting impact. They're bland, no personality. When they become more frequent or even chronic, people may note nausea or light or sound sensitivity, but these are never major features. Okay, that's tension type headache. Boring. Now, migraine's another story. It has its own personality because it can impact on your quality of life. It's usually moderate to severe and is commonly one-sided or throbbing, but these can vary from person to person and from attack to attack. You don't have to have one-sided headaches or throbbing headaches to have a migraine. You also don't have to have an aura or flashing lights or blind spots. In fact, the majority of migraine people don't have that. Worsening with physical activity is common in migraine, as is nausea and vomiting and light and sound sensitivity, and these can be major features which impact life. Tension-type headaches don't do that. Again, the personality of migraine. Some people with migraine have neurological symptoms like visual loss, flashing lights, vertigo, and even paralysis. These don't occur in tension-type headaches, and they do not occur in everyone with migraine, which is why we have many different types of migraine in our classification system. Some are very hard to tell from a stroke, because some migraines can imitate a stroke, just to make life more interesting. That's a personality, too. To tell the difference between tension-type headache and migraine, which, by the way, can occur in the same person at different times, the major hallmarks are one-sidedness, severity, worsening with activity, nausea, light and sound sensitivity. This brings us more towards a migraine story. The differences are blurred when headache is daily, and we will approach this in another video. But remember that both migraine and tension-type headaches can become chronic, where there may be no time when a person is completely free of a headache, as seen in chronic tension-type headache, chronic migraine, but it's also seen in medication overuse headache. There's also a thing called new daily persistent headache, which is beyond today's discussion. We'll talk about these things in another video. The daily headaches caused by overuse of painkillers is really an irony. The thing that takes away the pain is the thing that gives you more headaches. It's like if food tastes good, it's bad for you. Same idea. Now, cluster, that's another story. And talk about personalities. Cluster is not bland. It has a very distinct personality. These are commonly misdiagnosed, and that's sad because they're terrible suffering. These used to be called suicide headaches because of their intensity, but these days we have much better ways of treating them. I have personally had my share of migraines over the years, since third grade, and as many of you know, migraine can send you to a dark room where you want to quietly die. By contrast, a cluster patient is agitated, pacing, like a raging bull, maybe punching the wall. The hallmark, in addition to agitation, is that it's always on the same side, usually around the eye or temple, and it's very severe, enough to put you down. And it's always associated with the same tearing and one-sided nasal congestion. These are stereotypes. Cluster is very, very stereotyped. Now, these attacks are devastating. Now, when we get migraines, like I say, the kind that we get, they're severe. We go hide out somewhere, but they don't put you down. They don't make you sit there in a ball of sweat fearing the next attack. That's cluster. And the clusters don't last very long, but they can occur many times during a day. They can last less than an hour, less than 4 hours. They can occur up to 8 times a day. So migraine doesn't do that. And certainly tension-type headache is a weenie compared to cluster headaches and migraines. The cluster is more common in men, where migraine is more common in women. The cluster attacks can often occur when relaxing or asleep. Some of them have seasons. Interestingly, some of them actually can occur during the solstice or the equinox. It's interesting. We know it comes out of the hypothalamus of the brain, like migraine does. We don't know why the timer sets it off like it does. So you would think that it's really hard to miss a cluster when you see it, but it's commonly missed. The name cluster comes from the pattern, where there are clusters of days with one or more headaches per day for days or weeks, sometimes months or even years. Overall, you can see that there are distinct differences between these headache types, but sometimes people have atypical symptoms or combinations of these symptoms. Not everybody fits the cubbyhole perfectly. People who were misdiagnosed with so-called sinus headaches usually rethink their diagnosis when they hear about these other types of headaches, and there are additional hundreds of other headache types. Less common, you can read about these other headache types in more detail on the websites of the American Migraine Foundation or the National Headache Foundation. Remember, just because a person has the characteristics of migraine, tension-type headache, or cluster, they can still have something more dangerous. And it's very important that your doctor or healthcare professional talks to you about this. There's an old saying that even paranoids have enemies, and so it is true that even people with benign headaches could still have something else going on, and it's very important to describe any changes in your patterns. You must talk to people, and again, I keep harping on this. Your healthcare person needs to talk to you and not run you out of the office in 2 minutes and throw a med at you and say, here, let me know if it works. And beware of people who use the words complex migraine, complicated migraine, ocular migraine. These are not words. They don't exist in the headache world. And if people use these terms, they're particularly not tuned in to modern headache medicine. And modern headache medicine is not even that new. These terms disappeared many years ago. I hope this introduction was helpful. Please subscribe to our YouTube channel or to our podcast channel to get more information. You can also reach us through our website, www.theheadachesituation.com, and that will link you to our YouTube or our podcast channels. You can also, on that website, download a headache calendar. We have PDF files you can download from there. Remember, never give up on getting better control of your headaches. There's always something that's going to help. Thank you for listening.